Good afternoon, everyone, and welcome to Advancing Pharmacy Practice Together. This is a co-presentation with Mahmoud Abdulrahman, who's the president of the Egyptian Foundation of Clinical Pharmacy, and it's my pleasure to be presenting with Mahmoud today. My name is Paul Bush, and I'm the ASHP Vice President of Global Resource Development and Consulting. For those of you who've joined us, I'd like to point out that the handout is available on the GoToWebinar toolbar, and you can download it. And I encourage you to ask questions using the question box. We'll answer your questions after we complete the presentation. This webinar is being recorded and will be available to you and your colleagues to view approximately 24 hours after the conclusion. You will receive an email from ASHP affiliates with the recording and with the handout. So let's get started. Here's my colleague, Mahmoud Abdulrahman, and this is going to be our outline for today. We're going to do a welcome. We're going to have a brief overview of the Egyptian Foundation of Clinical Pharmacy. I'm going to talk to you about ASHP Global. We'll describe some of our resources that are available. And then Mahmoud and I are going to talk about the collaboration that we plan for the coming months. And then we'll end with questions and answers. So I'm going to turn it over now to President Abdulrahman to take it from here. There you go.
Thank you, Paul. Thank you very much for the American Society of Health System Pharmacists, ASHP, and for my dear friend and colleague, Mr. Paul Bush, for his amazing collaboration through these past years. I would like to give you a brief overview of the Egyptian Foundation of Clinical Pharmacy. Next slide, please. The Egyptian Foundation of Clinical Pharmacy is a national and regional organization concerned with clinical pharmacy, academic practice and research in Egypt and the Middle East. It's our responsibility to spread the knowledge as well as awareness of clinical pharmacy, optimizing the healthcare services and advancing the knowledge of healthcare professionals dealing with various drug-related aspects. Next slide, please. We have six committees in our organizing body. Academic Committee, Healthcare System Committee, Continuous Education, Research, Exchange, and Awareness. Each committee is designed and dedicated to handle a certain area of practice and education in Egypt and to start collaboration projects that will advance the career. Next slide, please. We started in 2015 with our official decree. We were recognized under Egyptian law as an NGO, number 5652 for the month of July in 2015. We had our first board meeting. Then we had a training and recruitment in 3 universities, the British University in Egypt, the Modern Science and Art University, and Ain Shams universities. Within a month, we have over 300 member students in all these 3 universities. Next slide, please. In 2018, we had our first annual meeting called the Future Pharmacy Education and Clinical Practice. It was in January 27 and 28th of 2018 in Cairo, Egypt. Next slide, please. Next slide. We had 8 speakers from different organizations and universities in the state. We had speakers from the American Society of Health System Pharmacists, ASHP, the American College of Clinical Pharmacy, ACCP, the Accreditation Council of Pharmacy Education, ACPE, the Board of Pharmacy Specialties, BBS, the American Association of Colleges of Pharmacy, ASCP, and we have top 2 American universities, pharmacy schools, the University of Minnesota and University of North Carolina, Ashland School of Pharmacy. Next slide, please. These were the speakers for our 2018 annual meeting. Next slide. Next slide, please. Next slide.
This slide?
Yes, this one. We have many partners nationally and internationally, as I mentioned before, the Egyptian Ministry of Education, Scientific Research, ASHP, BBS, ACPE, University of Minnesota, University of North Carolina. Next slide, please. Also, our partners include the European Association of Hospital Pharmacists, EHP, the European Society of Clinical Pharmacy, ASCP, the International Society of Oncology Pharmacy Practitioners, ISOP, Virginia Commonwealth University, VCU, University of Illinois, Chicago, UIC. Next slide. Our projects include, for the past few years, we have been able to establish a very good collaboration and communication with the previously mentioned partners to advance and start projects that will advance clinical pharmacy practice and education in Egypt. Next slide, please. One of these projects are with the University of Minnesota. One of them is a postgraduate research exchange program, and it aims at sending PhD students to get their degrees in the States. Another program with UMN is International Student Exchange Program for Minnesota pharmacy students in Egypt. Next slide. One of our most important project is a research network, and it's a network between Egyptian and international research centers and universities to advance research techniques, funding, scholarships, and guidance. While we plan to start a research center to carry out these goals. Next slide, please. Clinical Pharmacy Academy, establishing an internationally accredited clinical pharmacy academy to carry out accredited postgraduate degrees that ensure appropriate qualification and certification to practitioners. The academy is sponsored by international clinical pharmacy organization, universities, and Egyptian educational authorities. Next slide, please. In September 29th, celebrating the World Pharmacist Week webinar in collaboration with International Pharmaceutical Federation, which EFCP is a member organization and the only member organization other than the Pharmacist Syndicate in Egypt, launched the task force to implement change in pharmacy in Egypt. With participation from various collaborators, including universities and organizations in Europe and America. A task force to implement change in pharmacy have emerged. Data analysis and the gap analysis is being done, and the projects are being implemented with various partners around the world. Next slide, please. Our current and future projects with the American Society of Health System Pharmacists, like Paul will speak, including the ASHP certificates. We plan a very soon conference that will enlighten the collaboration between ASHP and EFCP, and also a pharmacy consultation services. Next slide, please. I would like to thank Paul and introduce him a little bit to our Egyptian colleagues here. Mr. Paul Posh is the Vice President of Global Resources Development and Consulting for the American Society of Health System Pharmacists, ASHP. He has held the position of Chief Pharmacy Officer in Duke University Hospital in Durham, North Carolina, Director of Pharmacy Services for Medical University of South Carolina, San June Hospital and Medical Center, and Detroit Osteopathic Hospital, and was Corporate Director for Clinical Pharmacy Services for Horizon Health System. Welcome, Paul.
Thank you very much for that very generous welcome, and again for joining us today. It's been very nice, pleasurable to work with you on lots of projects and also on this webinar today. So I'd like to share some information about ASHP briefly for you. ASHP represents pharmacists who serve as patient care providers in acute and ambulatory care settings in the United States and in other countries. We have nearly 57,000 members, which include pharmacists, students, and pharmacy technicians from the United States and around the world. ASHP has been in the forefront of efforts to improve medication use and enhance patient safety for a long time. We were formed in 1942, so we've reached our 75th anniversary. So let me orient you to how you can get to know us better. This is our primary website. It's available at ashp.org. And you can see on that website there that we've recently been thanking our frontline pharmacists for administering the COVID-19 vaccine this last week in the States. You'll also see some other things on the front page. The yellow bar at the top shows you, gives you access to our COVID-19 resources. So that's our ASHP primary website. But for our colleagues around the world, there's also another website, ASHP Global, that is developed for you, and it provides easy access to the ASHP programs and services that are designed and are most frequently requested by our international colleagues. And so you can see the web address. It's ashp.org/global. So I'm going to talk with you today about some of the work that we do. And ASHP does a lot of different things, really supported by the members that contribute to our programs, our educational programs, products, and services. So I'm going to go through some of that today. I'm going to start off, though, with a brief overview of our International Hospital Pharmacy Accreditation. So here is a slide that describes it. Now, there's a lot of detail on this slide, so what I would recommend is, if you are interested in learning more about this, that you download the slide deck and you can expand it. It's a PDF version. You can expand it and you can see all of the detail here on hospital pharmacy accreditation. But this is the accreditation of a pharmacy department in a hospital. And we've been doing this for just a few years. It's one of our newer programs, but we've had great interest around the world and accredited a number of hospitals already. But it provides formal recognition of the quality of services and care provided by your hospital pharmacy. It demonstrates your commitment to excellence and quality improvement, and can enhance the credibility and value of the pharmacy services within your organization and externally. So there's a lot of information here, but basically what happens is you contact us and we talk with you about whether you're ready for the accreditation, and if you are, you complete an application. The application comes to us, and then we talk with you more, and eventually we're gonna have a survey. We would do it on site if it wasn't for COVID-19. We've been doing the surveys, though, virtually using conference calls, and then we have a video tour of your facility, and we've been able to work that out. So if you're interested in the International Hospital Pharmacy Accreditation, please contact us. There is an international commission that oversees this, so it's got lots of input in terms of what the standards are, and it's really designed to meet the needs and expectations of our colleagues around the world. So now let me move on to the other accreditation that's relevant, the International Pharmacy Residency Accreditation. Now, this is very similar to the hospital pharmacy accreditation, but it's about your residency program. And we have, through our working with our international commission, we've established an international pharmacy practice residency. Now, you probably know that ASHP offers a PGY1 or postgraduate year 1 and a postgraduate year 2 residency as well. But this residency has been designed to fit the needs and the situations of trainees around the world. And it's a similar process where if you have a residency training program, or if you contemplate having one, you would contact us and talk with us. And it's Lene Mahaney, who I work with, who oversees this area. And you talk with Lene, and she would tell you about it, provide you information, and then if you'd like to proceed into the accreditation process, you would submit an application. We would talk with you more. We'd have some pre-survey checklists and questions, and eventually we would schedule the survey. And again, on site if we could, but if we can't, we'll do it virtually. So this is the other program that we have, and I wanted to tell you that the Children's Cancer Hospital in Egypt was our first international pharmacy practice residency accredited. So we're very proud to be working with our colleagues at the Children's Cancer Hospital in Egypt. So those are the accreditations that we offer, and we also offer a lot of help. One of the things we do is we offer assistance to our international colleagues. We have consultants that are internationally recognized pharmacy practice experts. They've got long-standing reputations for improving outcomes. Whether it's helping you develop and expand your clinical practice, optimize your pharmacy operation and supply chain, or expand your retail pharmacy services, we take pride in assisting our clients with any practice challenge they present. And recently, we've been doing quite a bit of work with telehealth, helping organizations organize and launch telehealth pharmacy programs. One of the things our consultants do is we assist organizations that are considering accreditation in either residency or hospital pharmacy. And Dr. David Warner, who's well known internationally, he's the individual who helps hospitals and their leaders determine whether they're ready, and he also offers a lot of training, and all of that is available as well through ASHP Consulting. But here's the overall list of the areas that we work, and I'm not going to read them all, but you can see them. Comprehensive pharmacy review, we work to advance clinical practice, help implement programs. We have a lot of expertise in medication safety and pharmacovigilance, pharmacy technician training. We in this country, and probably yours too, have spent a lot of time optimizing our sterile product compounding, and we utilize the USP Chapter 797 and Chapter 800 as our guide, but we do a lot of work in that area as hospitals strive to improve their compliance with those standards. Supply chain, retail pharmacy, we do have a search and placement service for pharmacy leaders. And as I mentioned, Dr. Warner's assistance with residency program development. So there's quite a bit we do, and all you need to do is contact us, and we will talk with you more about the possibility. Now, you probably are aware that we have a lot of resources that we've developed over the years, and as we've adapted our resources from live and in person to a lot of them are now available online, and so I'm going to talk with you about those today. But in order to find those, if you'd like, you can go to the ASHP Global website, and as you can see on the screen, there's a red box, a red arrow, and you'll find resources. If you click on that, you'll get to all of the resources that we provide. So it's ashp.org/global. So first I want to talk to you about the professional certificates. These are really very popular. These are online self-guided learning modules for pharmacy professionals. These certificates provide high quality, manageable, and practical professional development opportunities for practitioners and pharmacy personnel. Let me tell you a little more. These are the current certificates that we have. You can see some of them are new. You can also reach this website at ashp.org/global/professional certificates. Here are the new certificates. Some are out and some are coming out soon, but we're really excited about diabetes management, the pediatric certificate, the anticoagulation certificate. We built one around crisis and pandemic management because we've been living this, and we've also got one coming soon on well-being and resilience. So those are the new ones. We're going to learn more. You're going to learn more about that because we've got a special partnership with the EFCP on making these available to you in Egypt. Here's something for the pharmacy leaders, those who run pharmacy departments or are responsible for supervising staff. One of our newer products is the Pharmacy Competency Assessment Center. And you can read about this here, but basically it is an electronic resource with 54 key skills assessments for pharmacists and technicians. We continually update it. It's electronic. So basically what this is, I know that you have to do something to help make sure that your staff is competent on it when they get hired and when they on an annual basis. I know when I was a pharmacy chief, it was always a lot of work to make sure we had good competency training and assessment tools. Well, we've made those available to you if you're interested. And if you'd like to learn more, there's a YouTube video that you can access. As you can see the address there on the slide to learn about it. Next is our board certification resources. Many colleagues, I think there are hundreds of pharmacists in Egypt who are board certified. And we're really pleased that your country has taken this so seriously. And you're probably familiar with these board certification preparation resources that we have, but they're available. You're going to learn more about those because through EFCP, you're going to be able to access a couple of those at a discount. So let's move on, and I'm going to summarize that we do have a lot of other products and services available, things that you can find on our website. There's the Practice Advancement Initiative, PAI 3030, practice standards and guidance documents. We have lots of clinical drug information and resources. Here's a recently re-released the gold standard ASHP injectable drug information was just recently re-released. We've also got our journal, and all of the learnings that you do online are available through our e-learning portal. Lots to offer. We recently had our mid-year clinical meeting, and I thank those of you who were able to attend. It was virtual. First, we wished we were in New Orleans, Louisiana, but we couldn't be. So we did it virtually. We were very pleased with the number of individuals who came and joined us at the meeting. I can tell you, if you can believe this, it was almost 28,000 signed into that meeting at one time or another during those 4 days. And there was tremendous feedback. There are some good aspects to it, but really we wish to get back live and hope to, next December in Orlando, Florida. But we also have a few other meetings as well, and all that information is available if you'd like to take a look at it on our website. Now, here's something I encourage you to do. We now have an ASHP global news link. This is pretty exciting, and we just released one, I think within the last 24 hours. One came out, the December version. Now, for you to get that, what you need to do, if you don't get it, is to go to this web address and give us your email address and your name and things like that, and you will receive our news link that we plan to put out every month. So that's the way you'll be able to keep in touch with us, and we hope to make that available to you. And if you look in the December version, the one that came out last night, you'll also find that we're offering the critical care certification resource free to the world until March 21st. So take a good look at that. But that's the ASHP news link, and we're really pleased to be able to communicate with you that way. So now, Mahmoud and I are going to talk to you about some ASHP products available through the Egyptian Foundation of Clinical Pharmacy. And I want to do something here. Bear with me for just a moment. There, I was able to do it, Mahmoud. We have the wonderful new Egyptian Foundation of Clinical Pharmacy website. Mahmoud, you want to say a few words as I scroll through?
Yeah, go ahead, Paul. Thank you for the great presentation, and we value our partnership with ASHP, as I mentioned before. This is our EFCP new website. You can find the global pharmacy certificate, the ASHP global certificate that Paul is going to talk about it. ASHP through the Egyptian Foundation of Clinical offering now 3 certificates: the International Clinical Pharmacy Certificate Program, the Pharmacotherapy Board Preparation Certificate, and the Oncology Board Preparation Certificate. These are just the start. We are going to offer more certificates that ASHP already offers, and we're going to make it available in Egypt. We think that all these certificates are very important because it provide a good quality education for Egyptian pharmacists, which we desperately need right now. One of these certificates is the International Clinical Pharmacy Certificate, which qualifies pharmacists to practice in a clinical setting. I advise everyone to take a look at it because it's one of the important resources. Also, like Paul mentioned, we have a lot of strive here in Egypt for board preparation certificate and courses, and ASHP offers this. With our partnership with ASHP, now we can offer it in Egypt. Over to you, Paul.
Sure. So we're really pleased to have this partnership, making these available to you, and let's go over them in a little more detail. So this is what you can see in greater detail when it comes up. This is on the EFCP website. Let's look a little closer. Mahmoud mentioned a clinical skills certificate for international pharmacy. Well, this has been quite popular. It has 22 hours of continuing education. So think about it taking about 22 hours to complete, maybe a little longer. It's 100% online. It's a self-guided program with 17 modules. And once you complete the comprehensive exam, you earn the professional certificate at the end. So I've got another slide here with more detail. So these are the modules or the educational activities with that certificate. And they're designed to teach the fundamental concepts of patient-centered clinical skills for pharmacists. The course will present pharmacist-led activities in key clinical areas. So you can see that it starts off with an orientation, the importance of evidence, pharmacokinetics, our roles in transitions to care. Then we go into several disease states and special populations. And it winds up with a module on the importance of being a leader as a clinician, a leader working in your hospital, a leader with your colleagues. So that's a very popular certificate. Good for those of you who are just planning to transition from primarily a drug distribution-based practice to a clinical practice. This is a really good one. Now, the next one, I think many of you might be familiar with, but there's always more who want to become board certified. It's the Oncology Pharmacy Special Review course in the workbook. This is 25, almost 26 hours of CE. Again, it's 100% online and self-guided. This one contains 20 modules, and this is a summary of the modules that's available. You can see them here. Lots of different disease states and some pharmacogenomics. Now, on the website, the EFCP website, you'll find much more detail of this as well, both on his website and on our website. So that one's available. And the next one we have is the pharmacotherapy review course, and the practice exam in the core therapeutic modules. This one has 32 hours of continuing education for pharmacists, again, 100% online, self-guided. This review includes the review course with the 10 modules, the practice exam that you might be familiar with, and then the 15 core therapeutic modules. All of these are here, listed here with some detail. You can see the modules, and as we mentioned, this is also available on the EFCP website in detail. But these are the modules for the review course, and there's also modules for the core therapeutic modules, more depth, and something that I think many people are familiar with. Those are the products. I think I'll go back just to the website for a moment. And EFCP has done a nice job of putting the detail here on the website. So when you click on this, for example, you're going to get a lot of detail on it. So there you go. That's all the detail of these products. I wanted to maybe Mahmoud and I could talk a little bit about how you would access these. Mahmoud, so we've got on the website that they can order them on the website, correct?
Yeah, exactly. Anyone that is interested to participate or take any of the ASHP courses that are available through EFCP can go to the website. If you can go again to the website, Paul, if you
Sure.
please.
Sure, I will. Just a second. Here I'm going.
Yeah, here in the home page, and we put everything on the home page, like Paul said. So underneath this very nice illustration, you can find a button that says "Apply for the courses." If you click on it, you will go to another form that you have to fill. If you fill out this form, you can we will get an instant message that there is someone interested in applying for the form. We will contact you directly to establish the purchase or to pay the fees for these courses through AFCP bank account. And after the payment have been made, the codes for these courses will be transferred to you, and you can start having these courses. If you have any questions regarding the courses, the modules, there will be someone assigned from AFCP that can contact you to answer all your questions. And if there is anything you want to ask ASHP, we can directly contact ASHP for you.
Well, thank you, Mahmoud. So I hope that you take advantage of that. You know, those prices are less than you would pay if you bought them directly from ASHP. And so I encourage you to give that some thought. Going back now to here to our slide deck for just a moment. This is the segment of our presentation where Mahmoud and I are going to have some conversation about what we've been doing and you know, what are some of the plans. I'll turn it over to you, Mahmoud.
Yeah, sure. If you don't mind, Paul, I would to ask you some questions that are frequently asked in Egypt about ASHP, and I know that you are gracious enough to answer them.
Sure, that'd be fine.
So let's start. I would like to start by asking you, what is the history and the structure of the American Society of Health System Pharmacists?
Well, ASHP, you know, pharmacy organizations, you know, go back to the early 1900s. But in 1942, ASHP was formed. And it was formed by some individuals who were hospital pharmacists, and they were really from the University of Michigan and some of our early founding fathers. So ASHP was formed in 1942, and obviously it's been around now for 75 years. During that time, it's continued to grow. ASHP is a very large organization. There's a couple of large organizations in our country, APHA and ASHP, but ASHP has really been my home for my career. And so I've watched it grow, for 40 years. ASHP is a membership organization for professionals and pharmacy technicians as well. We've got a lot of student members, a lot of academic members, and ASHP, as I mentioned earlier, we have almost 57,000 members now. It's a growing organization, and it's been a particularly good year this year. I mean, I think people who are not able to see each other, live, they're really reaching out to ASHP to be the link for them to the profession. So, but we provide we have the membership, then we've got a number of sections. Sections are groups of members. For example, the pharmacy leaders, the pharmacy technicians, the pharmacy academicians, those who work in clinical pharmacy and research. We've got a lot of different sections. And then there's a board of directors. I had the opportunity to serve on the board of directors, and also had the opportunity to be one of the officers, and was president, and got to meet many of you as I traveled when I was president of ASHP. So ASHP is there. It's for you. I was hired to help expand our collaboration around the world, and I've really enjoyed it. I've been doing it for a year, and this is my second webinar for Egyptian pharmacists, and we hope to do a lot more. Thank you, Mahmoud. How's that?
Yeah, great answer, Paul. So for our next question, what is the ASHP role in the United States?
Well, we really are a broad role. I would say that it's the professional home of many. We're highly committed to education. For example, our mid-year clinical meeting offered 175 hours of continuing education credit. But where's that come from? It comes from our members. Our members are our presenters. So what happens is members who want to participate in our meetings and present, they submit a proposal, and it's reviewed by ASHP's educational division, and then they're communicated with, and they're our presenters. So education's big, but we're also an advocacy organization. We advocate for pharmacy with the state and governmental agencies and with the public in the United States. That's a big part of it as well. We oversee residency accreditation, which is an international program. I mentioned the pharmacy practice residency, that's international, but we also accredit our PGY1 and PGY2 residencies in many countries as well. And we also now we accredit pharmacy technician training programs. So accreditation, education, advocacy, being a home for our members. Those are the primary things that we do.
So into our next question, what ASHP Global does internationally?
Well, I think a number of my colleagues, for example, our CEO, Paul Abramowitz, Senior Vice President Doug Sheckelhoff, and a number of colleagues have really been very active internationally. As our organization's grown, they thought that it would be good to add a person responsible for that, managing and helping and collaborating with our international colleagues. So that's where my role came in. I work with David Warner, who many of you know, and I work with Lene Mahaney, who I think a lot of you know as well. That's the global team, and we are reaching out. We've done webinars like this, I think, for 25 countries now, and we've developed some really good, strong working relationships just around the concepts of collaboration. We have some products and services that some people are interested, but we're looking to find ways in which we can collaborate and support organizations like the EFCP. And sorry about the spelling on this slide, the EFCP, making sure that we are good collaborators, that we support your organization, and likewise, you support ours. And so we've been doing that, looking for ideas on how to collaborate. But I can tell you, as we've done these webinars to these 25 countries, all countries want to advance pharmacy practice. Countries are at different states of progress in that, but all want to progress, and that's where I think we have our common bond, working on projects like that. And anything that ASHP, anything I can do, to help, whether it's talking with the Ministry of Health or whether it's providing educational programs, we're there to do that.
Thank you, Paul. So into our next question, what vision do you have for the practice in Egypt?
Well, I think my vision is your vision. I believe, as I've talked with you and other colleagues, that you have some really good practice in many of your hospitals, but you'd like to see your hospital pharmacy practice be at a high level across your country. And to be honest, that's not different than any other country, not even different than the United States. We have our centers of excellence in different hospitals, and then we've got other hospitals that are at different levels. And what I mean by that is, if we measure pharmacy practice by the impact we have on helping our patients, some hospitals have more advanced programs for clinical patient care teamwork than others. So our country is on that same journey. But I believe that's what I understand, and that in Egypt, you're interested in elevating practice and elevating the profession and making it more rewarding for your pharmacists. So that's my vision too.
So after we settled on the vision, how do you think ASHP can help make this vision a reality?
Well, I offer my time and my colleagues' time to work with you. I would encourage you, Mahmoud, to and invite us to participate in some of the discussions that you and your organization have on your plans. And then once we're more knowledgeable about what you're doing, and we can figure out how we can help. We do have a lot of product services, a lot of people who can do training. So there's quite a bit. I think we're all faced with this COVID-19 for a little while longer. But we can do it virtually. I think, in fact, we're in many ways more efficient virtually than we are if we had to get in an airplane and come visit you. So I'd encourage you and your colleagues to invite us to participate in your discussions. It's got to be your strategic plan, but working together, we can let you know where we think we can help. We might have ways to make it quicker for you, or ways in which we can offer some programming for those who are interested in learning. You know, we can put on conferences. There's a lot of things that we can do, but I want it to be something that really fits in with what goes well in Egypt.
Absolutely, Paul. And as I mentioned earlier, we value our partnership. We look up to ASHP to guidance and support through this phase that our country is going through. And I'm sure with your help and with your support, we can achieve a lot of great things. I think the certificate is a step on the right direction, and we already started, and nothing can stop us. And now we have more events and more collaboration to come. And I think starting with a conference between ASHP and EFCP in Egypt very soon will be a very great step for us, and will form all our collaboration and open the discussion for more collaborations.
Well, thank you, Mahmoud. Let's see what questions we have. I've got the question box here, and I'm going to open it up. We appreciate your questions, and you can still submit questions through the chat box if you'd like. Just a moment, I'm making it so I can read it. Okay. I think some of the questions that have been asked have been answered. For example, what does ASHP refer to? And well, that's the American Society of Health System Pharmacists. That's our original name. What is supply chain? Supply chain is really what relates to the drug products that come from the manufacturers, and they reach our pharmacy departments. This is another question. Are there any events coming? Well, I think that, and someone asked if there would be any events that will be no charge. Well, this event has no charge, and Mahmoud and I haven't talked about whether there'll be a charge for the conference that we are thinking about. This course is free, what we're doing today. Here's another question from Nada. Are there any practical sessions with the provided certificates? I think that the clinical skills is a very practical certificate, one to start with. And Mahmoud and I will talk about others that could be good choices that are available on our website, like pediatrics, or also diabetes management. There's a lot of other ones that are there too, but I think if you're a clinician already, you probably want to think about some of the others, but if you're just getting ready to become part of the clinical group in your organization, clinical skills is the best way to start. Here's another question: what is better for me as a professional clinical pharmacist, a master's clinical or board certification or PharmD? Well, I think it depends what your education is. If your education is going to occur in Egypt, or you probably want to be thinking about the master's in clinical pharmacy. Now, board certification is separate. It's board certification by the BPS, or the Board of Pharmaceutical Specialties. As you learn about that, that doesn't require academic work. That requires work on your own, and you need to go to the Board of Pharmaceutical Specialties website to learn about the requirements to apply to take the board certification exam. And the PharmD is a good idea, except that, you know, only limited colleges and universities in the Middle East offer the PharmD. I know there are some. I know there are some, and you can look at those in the UAE, or I believe it's Lebanon and other places. But I'm not. I think the PharmD degree maybe there's a university in Egypt, but I'm not familiar with it. Here's a question again: how do we reach to the topics to see them later? Well, I would suggest that you go to the links that we provided, either on the EFCP or on the ASHP website. I think I'll take one more question here. Nada is asking, and maybe Mahmoud can help me with this answer. She's asking, so what I mean is that all provided courses are 100% online. Does that mean there will not be hours dedicated to practicing in some clinical institutions? I think that what you're asking is, I think you answered it correctly. These online courses can be used to help prepare you for clinical training on site in some of your organizations. Now, how those clinical trainings are organized will be dependent upon, for example, the hospital, if they have an opportunity for clinical training. But these online courses are the didactic or the learnings that you would do to prepare you to have that online clinical practice. So I think we've answered a lot of questions, and so we appreciate it. Thank you for those questions. Mahmoud, did you want to add anything?
No, I just want to thank you and thank everyone who's attended. Thank Moyo for her help with the webinar, and thank all the great team of ASHP, of course, to you, Paul. Yes,
and it's been a pleasure. It's been an honor to speak with you today. Now, you know how to reach Mahmoud and his group at EFCP. You can reach me by going to ASHP Global and go to the Contact Us box, and you can send me a note, and I'll answer any of your questions and continue dialogue with you as well. So remember, the slides are available. You can download them and you can take a closer look at them. For those of you who attended and for those who didn't attend but registered, tomorrow about this time, you'll receive an email, and it will include the recording. So if you'd like to share the recording with your colleagues, that'd be fine. It'll also include the slide set, and we might ask you a few questions about how you liked our, give us some feedback on our webinar. So I think that's going to wrap it up. Thank you all. I wish you the best, and have a good evening.
Thank you, Paul. Have a great evening too. Thank you, everyone.